Testosterone is often called the hormone of masculinity. It fuels energy, builds muscle, supports sexual drive, and plays a critical role in reproduction. But when we talk about male fertility, the story of testosterone is far more complex than people usually think. Many assume that more testosterone equals more fertility, but that's not always true. In fact, too much external testosterone can actually shut down sperm production completely. In today's video, we'll dive deep into the relationship between testosterone and male fertility. We'll look at how testosterone works inside the male body, why low or high levels affect sperm health, the risks of testosterone replacement therapy, TRT on fertility, and what options men have if they want both vitality and the ability to father children. Testosterone is the key male sex hormone, and although we often associate it with muscle, strength, and sexual drive, its role is much deeper. It is produced mainly in the testes, but production doesn't happen automatically. It's carefully controlled by the brain. Specifically, the hypothalamus and pituitary gland work together with the testes to form what scientists call the HPT axis, hypothalamus-pituitary-testes. Here's how this system operates. The hypothalamus, located in the brain, releases a chemical signal known as GnRH, or gonadotropin-releasing hormone. This hormone travels a short distance to the pituitary gland, which then releases two key hormones, LH, or luteinizing hormone, and FSH, follicle-stimulating hormone. LH travels through the bloodstream to the testes and tells specialized cells to produce testosterone. Meanwhile, FSH, working alongside testosterone, directly supports spermatogenesis, the intricate process of creating sperm cells. This means testosterone is not just about building muscle or maintaining libido. Inside the testes, high concentrations of testosterone are absolutely essential for producing healthy sperm. Without enough of it, sperm counts can fall, sperm movement slows, and fertility suffers. But here's the critical twist. Testosterone levels in the bloodstream need to remain in balance. When levels are too low, men may feel constantly fatigued, lose muscle mass, struggle with motivation, and experience reduced sexual performance. On the other hand, when levels are artificially raised too high through external sources like anabolic steroids or even improper testosterone therapy, the brain interprets this as too much testosterone and shuts down the HPT axis. That means GnRH, LH, and FSH all decline. The testes stop producing testosterone locally, and sperm production can drop dramatically or even stop altogether. So, testosterone is vital, but maintaining the natural balance is the real key to both health and fertility. When testosterone levels fall below normal, the effects are often noticeable in many areas of a man's life. Low testosterone, often called low T, doesn't just mean less energy, it can directly impact fertility in ways that many people don't realize. First, testosterone is critical for spermatogenesis, the process of producing sperm inside the testes. Without sufficient testosterone in the testicular environment, sperm count drops, sperm motility, or the ability of sperm to swim effectively declines, and the shape or morphology of sperm may also become abnormal. This combination can make conception more difficult or even impossible in severe cases. Second, low testosterone also affects sexual function, which indirectly influences fertility. Men with low T may experience reduced libido, fewer spontaneous erections, and difficulties with performance. Even if sperm are still present, reduced sexual activity lowers the chances of natural conception. Third, low testosterone often comes with broader health challenges that further affect fertility. Conditions like obesity, type 2 diabetes, or metabolic syndrome can lower testosterone while also decreasing sperm quality. Stress, poor sleep, and chronic illness all contribute to the same cycle, worsening hormone balance and reproductive health. Psychologically, low T can cause fatigue, irritability, or mild depression. These emotional shifts reduce motivation for intimacy and family planning, further complicating fertility efforts. It's important to note that not every man with low testosterone is infertile, but the risk is significantly higher. For couples struggling to conceive, testing testosterone is often one of the first steps in identifying the underlying issue. So while testosterone is not the only factor in male fertility, it plays a central role. Without it, both the quantity and quality of sperm decline, and the physical and emotional aspects of reproductive health suffer as well. At first glance, it might seem obvious. If low testosterone hurts fertility, then adding testosterone from the outside should fix the problem. Unfortunately, this is where one of the biggest paradoxes in male reproductive health appears. External testosterone, whether in the form of injections, gels, patches, or anabolic steroids, can actually make a man infertile. Here's why. When you introduce testosterone into the bloodstream, the brain senses that levels are already high. In response, the hypothalamus reduces the release of GnRH. Without GnRH, the pituitary gland stops releasing LH and FSH. Remember, LH and FSH are the two crucial hormones that tell the testes to produce testosterone locally and to generate sperm. Without that constant signal, the testes essentially go quiet. The consequences can be dramatic. Natural testosterone production shuts down. The testes may physically shrink in size from lack of activity. Most importantly, sperm production drops sharply, sometimes all the way to zero. This condition, called azoospermia, means there are no sperm in the semen, and natural conception becomes impossible. What makes this so paradoxical is that on the outside, men often feel better while on TRT. Energy rises, muscles grow, libido returns, and mood improves. Yet at the same time, their fertility may be silently disappearing. Many men only discover this when they try to start a family and realize conception is no longer possible. Can fertility return after stopping external testosterone? In many cases, yes, but the recovery is unpredictable. For some men, sperm production restarts within a few months. For others, it may take a year or more. And for a smaller percentage, fertility never fully recovers. Age, duration of therapy, and individual biology all play a role. That's why doctors strongly caution younger men, or any man planning to have children, against starting TRT casually. While testosterone therapy may improve certain symptoms, the trade-off in fertility can be life-changing. So what can men do if they are struggling with low testosterone but still want to preserve or improve fertility? The good news is there are alternatives to traditional testosterone replacement therapy that can raise testosterone levels without shutting down sperm production. One option is HCG, or human chorionic gonadotropin. This hormone mimics the action of LH, sending a direct signal to the testes to keep producing testosterone naturally. Because it stimulates the testes rather than replacing their function, sperm production is maintained and fertility is preserved. Another approach is clomiphene citrate, often known as Clomid. This medication works at the brain level by blocking estrogen's feedback signal. As a result, the pituitary gland releases more LH and FSH, which stimulates both testosterone production and spermatogenesis. Many younger men with low testosterone who still want children benefit from this strategy. Aromatase inhibitors can also play a role. These drugs lower the conversion of testosterone into estrogen, effectively boosting available testosterone levels while keeping the HPT axis active. Beyond medication, lifestyle changes are critical. Weight loss, regular exercise, proper sleep, stress reduction, and limiting alcohol or tobacco all naturally support testosterone production and sperm quality. Sometimes these changes alone can make a significant difference in fertility outcomes. For men facing both low testosterone and fertility challenges, these alternatives often provide a safer path than external testosterone. They respect the body's natural feedback systems, maintain testicular function, and give couples a better chance of conceiving. The key takeaway here is that boosting testosterone doesn't always mean shutting down fertility. With the right medical guidance, men can find a balance that supports both their vitality and their future family plans. By now, it's clear that testosterone and male fertility are deeply connected, but not always in the way many people expect. On one hand, low testosterone can undermine energy, mood, sexual function, and sperm quality, making conception more difficult. On the other hand, adding testosterone from outside sources like TRT or anabolic steroids can backfire by shutting down the body's natural sperm production. So what are the main lessons? Testosterone is essential for healthy sperm production inside the testes. External testosterone can raise energy and libido, but may cause infertility by shutting down the HPT axis. Alternatives like HG, Clomid, or lifestyle changes can improve testosterone while preserving fertility. On every case's unique blood tests, medical history, and fertility goals all need to be considered before treatment. The bottom line is this: testosterone is not just a male performance hormone. It's part of a delicate system that controls both vitality and the ability to create life. Protecting that balance is key. For any man considering therapy, the smartest move is not to self-diagnose, but to work with a knowledgeable doctor who can guide the process safely. With the right choices, it's possible to enjoy the benefits of healthy testosterone levels without sacrificing fertility or future family plans. In conclusion, testosterone is both a powerful ally and a potential obstacle when it comes to male fertility. It fuels energy, confidence, and sexual health, but it also plays a delicate role in sperm production. Too little testosterone weakens fertility, yet too much from external therapy can shut it down completely. That's why it's so important to understand the science before making decisions. If you're experiencing symptoms of low testosterone or struggling with fertility, don't rely on quick fixes or internet advice. Get a proper diagnosis, talk openly with a doctor, and consider treatment options that support both your health and your future family goals. Remember, true vitality is not just about feeling strong today, but also about preserving the possibility of creating life tomorrow. If you found this video helpful, please like, share, and subscribe for more science-based insights into men's health, hormones, and fertility.